Good morning, everyone, and welcome to another edition of United Way for Southeastern Michigan's What's the Word Wednesdays. My name is Audrey Walker, and today we're very excited to bring you a panel discussion focused on mental health and its relationships to substance use and abuse. Mental health conditions and substance use and abuse have all been on the rise since the beginning of the COVID-19 pandemic. And we know that winter is a particularly tough season for many people facing these challenges. United Way is proud to support many organizations in Wayne, Oakland, and Macomb counties that focus on treating mental health conditions and substance abuse. And today we're joined by three such organizations. I'm going to introduce each panelist and let them say a few words about themselves and their organizations one by one. And then we'll move into the Q&A session for the rest of the town hall. As a reminder before we get started, please put your questions for our guest speaker in the chat box on Zoom or into the comment section if you're watching on Facebook. And closed captions have been enabled in Zoom and Facebook Live. To turn them on, please click on the Show Captions button at the bottom of your screen. So first up, we have Erinn Alderman Rowland, care of Southeastern Michigan. And Erinn has an extensive background in social services and has worked with children, adolescents, and families in various settings in Illinois and Michigan. She began her career at CARE as a case manager in supportive opportunities for families program in 2017. And she currently serves as the director of clinical services at CARE. Erinn earned her Bachelor of Social Work in 2012 and Master of Social Work in 2013 from Wayne State University. So welcome, Erinn.
Hi. So I'm Erinn Alderman Rowland. I just wanted to talk a little bit about CARE. We are a nonprofit that's been serving Southeast Michigan for 45 years, and we serve over 100,000 people annually. We serve as an employee assistance program, a student assistance center, an outpatient clinic, and we provide a full spectrum of substance use services that include prevention, treatment, and recovery. The hallmark of this being our Recovery United Community Center, which houses our nationally accredited peer recovery coaching program. Our employee assistance program specializes in serving municipalities and providing trauma-based work with first responders. Our Student Assistance Center is contracted with the majority of the school districts in Macomb County to provide assessments and counseling to students. Through our outpatient clinic, we provide specialized substance abuse professional assessments to Department of Transportation employees, and we have a driver's license restoration program. We also provide substance use outpatient counseling services to adults in Macomb County. CARE's prevention department provides school-based life skill programs that encourage healthy lifestyles, and they adapt to address the current issues that students are facing, such as vaping. We currently offer a vaping intervention class, which is called In Depth. If you can go to my slide. Next slide. Yeah. So this is In Depth, and these are our dates for that program. Next slide. We have a vaping cessation class called Not on Tobacco. Those are the dates for those upcoming programs. And then lastly, we have a marijuana intervention class called Prime for Life 420. Our parenting classes run several times throughout the year. And then we also have home-based case management programs that focus on assisting parents with developing their parenting skills. Our SOFT program, Supportive Opportunities for Families, is for parents that identify as mothers, and Developing Active Dads is for parents that identify as fathers. Our peer recovery program is a highly specialized accredited program of peer recovery coaches that serves in 5 courts. We also have a quick response outreach team that assists those in the community that have recently overdosed. We recently obtained a grant through SAMHSA to launch our Teen Solutions program. Through Teen Solutions, we will be able to provide substance use outpatient counseling and peer recovery coaching services to teenagers. The families of our teenage participants will also receive family coaching services to assist them in supporting their teens' recovery. Lastly, we have our 27th annual parenting conference on March 4th. Our keynote speaker is Rosalind Weissman, the author of Queen Bees and Wannabes, which is the book that the movie Mean Girls was based off of. This conference is open to the public, and we do have scholarships available. Professionals can earn sketch and social work CEU credits for this as well. And that's all I have for care.
I can say that's all, but that's a lot. So thank you so much
It is
for
a lot.
sharing all that wonderful information with us. Next up, we have Dunya Barash from Families Against Narcotics. And Dunya serves as FAN's Director of Operations. She is a social worker by degree, as well as a certified prevention specialist. She has experience in community organizing, policy change, and engaging communities and teams to develop strategies to combat the opioid crisis. As a first-generation immigrant navigating the system and recognizing the importance of resilience, she has shared her approach with the community organizations and people she serves. Dunya's nonprofit work experience includes Royal Family Kids Camp, the Arab American and Chaldean Community Foundation, the Sterling Heights Drug-Free Coalition, Faith in Action during the Flint water crisis, care of Southeastern Michigan, and developing her own initiative called the Sisters Collective, which helps to meet the needs of families and women. Welcome, Dunya, and tell us more about the work you do at FAN.
Hi, everyone. Thanks so much for having me. So really, I'm just here to kind of open some dialogue and be able to answer questions for the panelists. But to give you guys some insight and information about what we do at FAN, we really started as an organization that was looking to meet the needs of families that did not know what to do in the midst of the beginning of the opiate epidemic. Over the past 14 years, we've really developed this continuum of care that started with Hope Not Handcuffs. So many people may be familiar with Hope Not Handcuffs, but if you are not, it is a resource in many communities across the state of Michigan. 125 police departments partner with us, where anyone who is looking for linkage to treatment can walk into a police department, and that police department will call Families Against Narcotics, and we will get that person set up with resources related to treatment, peer recovery coaching, and really that care that's needed to get someone through a time when they are looking for hope and looking for support. And so Hope Not Handcuffs has really grown over the past 3 to 4 years, and it is in police departments across Southeastern Michigan. In addition to that, we have a pretty robust peer recovery coaching program. We serve around 800 folks every single month on an ongoing basis across the state. So we're able to link people to peer recovery coaches that can meet with them in their community and help them walk the steps of recovery and what that means to them. We also have a family recovery coaching program, which is really unique to some of the work that FAN started kind of from the beginning. You know, our initiative was really to be able to provide families with resources and the ability to navigate the disease of addiction. And so with our family recovery coaching program, we help families to build healthy relationships with their loved ones that are struggling with substance use disorder, and really being able to know how to navigate something like this and how to set boundaries and how to be able to take care of themselves throughout something that can be so difficult for many families. We also have a comeback quick response team. We have 20 teams across the state, which is essentially where people, a peer recovery coach, a family coach, and a police officer will go to the door of people that have experienced an overdose or have suspected substance use in the community. And they will knock on the door and get them linked to resources and really ask them where they're at and figure out how we can help them get started in their recovery process, or just make sure that they are staying safe in the meantime. In addition to that, we provide naloxone trainings across the state of Michigan. So anyone that is looking to do a naloxone training, we offer them virtually, we offer them in the community, and that can be found on our website. We have 20 chapters across the state of Michigan. So depending on where you're at, there's always probably a place where you can go and join a monthly meeting where we provide education to families and the community. And then kind of finally, to wrap this up, our two last programs are our harm reduction program, which is called Harmless. It's based in Macomb County, and we provide harm reduction services to folks that are actively using drugs, and really just make sure that people are staying safe, that they have access to medical care, and that we're treating people with dignity and respect all throughout this process. Lastly, something really interesting and very important to someone's recovery is having a safe place to live. And so we provide sober living scholarships to folks that are leaving treatment. And anyone across the state of Michigan can access our sober living scholarship program. So that is all I have for my time. And I look forward to questions or anything that comes up.
Great. Thank you so much, Dunya. We really appreciate all that information you shared, and especially highlighting on, making sure we're treating people with dignity and respect as they're going through a hard situation or hard time. I appreciate you mentioning that. And so last but not least, welcome to our third panelist, Amy Hostinsky of Oakland Family Services. Amy has 10 years of experience working in mental health with a specialty in trauma, life changes, substance use, depression, bipolar disorder, and anxiety. She received her master's degree in social work from the University of Michigan and is a certified advanced alcohol and drug counselor. Amy currently serves as the clinical supervisor of Oakland Family Services Day One program. Before coming to Day One, Amy worked as a clinician for women's inpatient programs at Elmhurst Home and Personalized Nursing Lighthouse. Afterwards, she worked in an outpatient setting at New Frontier Counseling Services, completing group and individual sessions for people on probation and providing educational information and therapeutic services. So Amy, welcome, and please tell us more about the Day One program.
Hello, everyone. So my name is Amy, and I'm the clinical supervisor of the Day One program in Pontiac. So I wanted to tell you a little bit about Oakland Family Services and our buckets, because we do a lot of different programming. So in our prevention bucket, we have foster care and adoption, as well as some of our early learning communities. In our education bucket, we offer children's learning centers, as well as more early learning community type of ideas. And then the reason why we're here today, we're talking about treatment. So I'm going to go into each of our treatment programs that we have that focus on both substance use and mental health. So we have Day One. We have Project Recovery Intensive Services for Mothers, which is also known as PRISM, and we have specialized services for youth. Next slide, please. So on our Day One program, we offer services for ages 4 and up. We have an intensive outpatient treatment program, and that program is SUD focused, but we also offer outpatient treatment that includes both substance use and mental health. We realize that adolescents are a specialized group of people that need individualized services, so we focus on adolescents as well. We offer group therapy strictly geared to their age group, as well as individual therapy. And all of our Day One services offer group and individual psychiatric services, individualized treatment planning, case management, and that is with our SUD clients, as well as peer support, which is primarily with SUD, but we have utilized it with our mental health clients as well. Next slide. Then we have this really amazing program, as I said before, Project Recovery Intensive Services for Mothers. So that is for pregnant and parenting mothers. We offer a few different levels of treatment. We have our intensive outpatient treatment and our outpatient treatment. And this program is SUD focused. So just like our other program, we offer the group and individual services, the psychiatric services, the treatment planning, but we also have a case manager and an outreach worker. So the outreach worker is a special part of the program where they reach out to clients if they have needs and support them, as well as outreach to the community. And we also offer transportation to and from the agency for sessions and things like that, as well as on-site childcare. So every need is taken care of. And then we have, last but not least, our specialized services for youth. That is for youth ages 5 to 21. This is a bit of a higher level of care. We offer individual, family, and group counseling, case management. You'll see we offer in-home services, but we also offer services in our offices. We offer peer and parent support, community living support and respite services, psychiatric services, and wraparound services. We have 3 locations in Oakland County. We have Berkeley, Walled Lake, and Pontiac, and that covers Oakland Family Services.
Great. And thank you so much for sharing. All of this is such important information, and we've got a lot of questions here. I think what I'll do is I'll start with asking questions to a specific person, but if you have some insights or want to add something else on, please jump in here, and then so we can get through the questions that we have. So one of the questions that we have to start out with is, what is the difference between substance use, substance abuse, and dependence? And I'm just going to put that over to Erinn if you want to start with that question.
Sure. So we would say substance use is, I mean, it's what it sounds like. It's using a substance. Abuse, we define that as misusing the substance, whether it's taking maybe painkillers not as prescribed, excessively drinking, excessively using substances. And dependence is the physical condition of your body reacting to substances.
Okay, that's very helpful to know. And then, so that for our next question is, how can someone tell that they have a problem with substance abuse? And what is the first step that they can take? And I'm going to direct that toward Amy, since you were talking a lot about treatment. I'm just curious what you have to say on that.
I think that knowing if you have a problem with substance use kind of depends on the person. I talk with clients about, it's not a certain number of things that you do, like a certain number of drinks or a type of drug that you use. It just really depends on how it affects you as a person and if it's causing problems in your day-to-day functioning. So how does a person get treatment? There's lots of different options. There is, for example, you can call Access in Oakland County and they can help with locating services, and Access is available in all counties. You can also call any of our agencies, and I'm sure we would be happy to help and reach out and provide support.
Great. And then for those of us, so we're talking a lot about the holidays. Sometimes we're all seeing somebody, maybe a family member we haven't seen in a while. It's been a couple of years. Maybe we're concerned about a loved one that's struggling with mental health or substance abuse issues. So what advice do you have for people to get them help? And I'll direct this toward Dunya first, if you want to answer that.
Absolutely. So definitely, I think we can resonate here at FAN that we definitely see an increase in families and folks seeking treatment during the holidays. It's a time where, people naturally gather together. I think one of the things that I would say is if I noticed a loved one that was a little bit different than usual, if it's a safe place to have a conversation, maybe opening it up to them and being able to just share with them that you notice that they're a little bit different and if there's anything that you can do to help. The other thing too, I think that really empowers families is getting themselves educated on it. So that way they actually kind of know what they're looking at and know what they're dealing with. So if they do believe that their loved one is struggling with substance use disorder or mental health, they could, join a group like Families Against Narcotics and get a family coach. Or if they are trying to learn more about mental health, they could join a NAMI group. I think the more education, the less we are able to put our biases and stigma on that person that's struggling and really be able to meet them where they're at.
And now when you say a family coach, what does that look and feel like?
So at FAN, a family recovery coach is typically a family will reach out to us and we get them a family coach that's assigned to them, and they will work with them for it's about 24 sessions, and they actually have a curriculum that they work towards. And so it's a unique program because regardless of really where the family is at or where their loved one is at, there's skills that a family can use that they can take throughout this journey. And so usually they'll meet with them virtually or one-on-one in the community, depending on the availability of a family member. And sometimes it can look like maybe a mom meeting with a family coach, or it can look like a significant other.
Great, that's awesome. I just know that sometimes we talk a lot about like what services are available, but people don't know what they look and feel like to them. And so I just wanted to put that out there because we want to make sure that that people feel comfortable and know what to expect when they are reaching out either on behalf of a loved one or themselves, even just getting curious about, what's available and how they're going to be treated and how it's going to feel for them too. I think that's really important for us to think about as well. And one of the questions, I guess this could be for everyone too, is thinking about if, substance use and abuse and mental health go hand in hand, or if you can experience one without the other. And if you want to just talk a little bit about what your thoughts are on that, or what you've seen or observed with your organizations, that would be great. Erinn, if you want to start with that question.
Yeah, so I will say, I think that you can have some mental health concerns without having substance use, but if there's substance abuse, there's mental health condition that goes along with that. So really, even though we might not necessarily be saying you have there's a co-occurring disorder, that's really how we're treating it, because those two really do go hand in hand when there's substance use involved.
Sorry, Amy, if you want to share.
Yeah, so I agree. We talk about co-occurring disorders. I think what we see a lot of is that people are just trying to cope. So they are using substances to help manage their mental health disorders. And I think we're all just trying to do our best.
Mm-hmm. I can chime in. So I definitely agree with both of the ladies on the panel. We definitely see substance use as something that is more co-occurring. And I think the biggest issue kind of, that comes up for a lot of families and people that are seeking treatment is that they're not necessarily traditionally treated together. And so it makes it really difficult for a lot of folks that may have, some severe mental health issues that are struggling with substance use disorder and vice versa. So I think that we could definitely do a better job at recognizing that they really go hand in hand.
Mm-hmm. And, just speaking to that as well, during the last 3 years, obviously with the pandemic and everything, I'm curious to know from each of you what you've seen change in the landscape of mental health services. And also, what still needs to change? What are things that we can be advocating for within our community? And Dunya, if you want to start with that.
Sorry. So I think the one thing that we've probably all seen throughout this pandemic is that we started to kind of see a decrease in our numbers and folks that were struggling with substance use disorder or experiencing overdoses and things like that. And we, after the pandemic, have seen kind of an uptick in folks that are struggling with mental health or struggling with substance use disorder. I think that there's, many different things that have kind of gone into play is the lack of mental health professionals and professionals that are able to provide services to substance use disorder, potentially people who have transitioned out of roles during this 3 years. We've seen hours reduced during this time for people trying to access services. And so I think, that all of these things kind of created this perfect storm for us to see this increase in folks that are struggling. I do think that one of the things on a positive note is that people are talking about this a lot more. Families maybe don't necessarily feel the same stigma that they did, especially because we did kind of bring light to the fact that, during this pandemic, many people did experience increase of situations related to mental health or feeling isolated, especially because for many people in the recovery community, connection is so important to maintaining their recovery. So it was a really difficult time for folks. But I do think that we're starting, I think, finally to really see our services within our counties and things like that are able to really starting to be able to meet the needs of the folks that are accessing our services. And I would just like to continue to see that increase.
Yeah, definitely. And I love how you point out kind of that connection that's essential in that recovery community. Obviously, we realize how that connections are essential for all of us as well, but even more so when you're thinking about something like that. So that's good that we're able to get people connected and potentially stay connected even when they were more remote, but also as things are more in person now as well. Erinn, do you want to answer that question of what you've seen in the landscape of mental health over the last 3 years?
Yeah, one of the things I've seen is there has been a really big disconnect, it seems like, with everything being virtual. So one of the things that CARE has really been actively working towards is getting everything back to in person. So all of our one-on-one services, whether it's case management, therapy, peer recovery coaching, all of those services are back to being in person. So I think that that's been really great to kind of help get that connection back on track. Our classes, we're moving towards getting those back in person. There's still some virtual options right now, but it's, we're really looking forward to making everything in person again, and we're getting there.
Very good. And then Amy, can you share with us your insights on that as well?
I love what both of the ladies have said. I agree with everything. One of the things that I've noticed, we all at Oakland Family Services, we are also trying to do as many in-person services as we can, because we know that's important and clients respond really well to in-person services. But one thing that we hear a lot is they are loving the virtual services as well. We've have a lot of clients that struggle with transportation issues. So they've been really enjoying more virtual services, and it's allowed more people to connect to our services.
That's so valuable. And so, we're so grateful to have all of you here, Erinn, Dunya, and Amy, for sharing more about the work that each of you do. I know we've had a lot of people watching today that have learned something new. I know I have. And so it's just really important that we're all just lifting each other up in the services and resources that are available within all of our communities in Wayne, Oakland, and Macomb County. It's definitely important work to help people that are dealing with mental health and substance abuse issues. So we really appreciate, again, you joining us and all the work that your organizations are doing. And we do have a few more updates before we close out today's event as well. So as a reminder, for anyone in our community who may be experiencing a need, our 211 helpline remains available 24 hours a day, 7 days a week. And this includes getting connected to resources like food, utilities assistance, and much more, including some of the resources that we were talking about here today. We maintain a running list of available services in the community and connect you to the support that you need. You can also look up resources in your area by using our 211 resource database at unitedwaysem.org/211. So our last town hall of the year takes place next Wednesday on December 21st. And we are excited to welcome our partner, Gleaners Food Bank, to share more about how people can support food service programs through volunteerism and donations. So that'll be a great way to wrap up our year. We appreciate all of you joining us for this town hall and all the town halls we've had this year, and all of our panelists and organizations that have joined us as well to make our community a better place and a wonderful place to live and work as well. So stay updated on upcoming topics and watch replays of our previous town halls. Please visit unitedwaysem.org/virtual town halls. And the website is also included in the chat box. So thank you everyone so much. We will see you soon, and stay safe and continue to live united.